Welcome everybody. This case is a 40 years old patient who was presented with a traumatic posterior dislocated crystalline lens together with traumatic mydriasis. The pupil is fully dilated. Doing a core vitrectomy to clarify the vitreous around the crystalline lens and starting to remove the lens. Going with a cutter, sometimes going with a vacuum together with cutting, and sometimes going with just a vacuum to aspirate this soft crystalline lens. After complete removal of the lens, then going for the periphery to do vitreous base shaving, and it is so important to examine the periphery to check if there is peripheral retinal break or not, because the trauma may cause retinal dialysis or retinal breaks. Then going back into the anterior segment and starting to do a pupilloplasty, going at the lower part of the cornea, gripping the iris, and going with the needle 10-0 Prolene. Then going for the other side of the eyes, then catching the thread with a forceps and going from the wand and making a loop, and then holding both sides and approximating these parts of iris together and cutting the suture at the end. Then repeating the maneuver at the upper side of the cornea, going for the iris in the upper side near the corneal wands, making the same maneuver, going from side to side in the iris, and then again making a loop and suturing both sides of the suture together. Now the iris is fully prepared to make a retropupillary iris claw implantation. The pupil is now regular, can hold the IOL with a good stability. So putting the IOL inside the AC, and then inclination of the first part, and then inclination of the second part. Injecting a bubble of air to form the AC, and going for suturing the cornea with an 8-figure suture, and then cutting the suture and the hydration of both sides. And this is the final view of the operation, and thank you for watching.